Come on. Monte, Roulier, linking communities and clinics with commons.
Hello, I'm Monte, and it's great to join you. So most of my personal and professional journey has centered on this idea of how we create healthier communities, and we've started to explore what is it that actually creates health. And I think there's general agreement that it's our healthcare access, it's our genetics, and it's this big 70%, which basically makes up our economic environment, our social and our physical environments, the quality of our air, water, and soil, how excluded or included we feel, and our economic status. And yet, $3 trillion of our dollars mostly go to that traditional medical services, which is certainly very important, but it's disconnected with where health actually is created. Because health, as we know, is not it's not a medical intervention, it's a byproduct of our communities working. And so all the things that we're knowing and beginning to learn is that it's people working in groups, working through partnerships and coalitions that have the best chance to actually create healthier communities. So have the best chance of advocating for healthier air quality policies, to plant trees, to actually create safe routes to schools, to create caring environments for young people and seniors. It's people working in groups that give us our best chance for healthier communities. But just working in groups doesn't actually guarantee success. In fact, there's a lot of groups that have good intentions that aren't getting results. And the difference between those that are getting results and those that aren't often come down to meaningful access to data and tools allow them to kind of advance their community change work. And it's one of the reasons why a number of us created the Community Commons. It's a public good access portal that allows community change makers access to the types of data and tools and maps and advocacy tools that help them to advance their healthy communities work and to be able to learn from each other across the country. It's built on a very powerful data engine. We keep up about 10,000 data layers so that you can start to look at data of all these areas down to zip code, block, unique geographies. And again, it's accessed publicly anywhere in the country or the world for that matter. And it's one of the reasons why Kaiser Permanente decided to build their new community health needs assessment off of this tool, so they could start to look at how their community benefits and their community partnership investments actually link back to the clinical settings. So that within a couple of clicks you can have 20 or 120 very quick community level indicators. And why the Centers for Disease Control built their vulnerable population footprint off the same area, so we can start to explore where our most vulnerable neighborhoods are. And catch this, in the spirit of the Commons, KP and CDC give this away publicly available to everybody. So that if you're in Cincinnati, for example, in your coalition that doesn't have a lot of money, but are trying to take on food access, you can at a couple of clicks start to access where your farmers markets or where your fast food restaurants are located to schools. You can start to get trends on obesity and diabetes and where that relates based on race and differences. Where you can start to really explore how food access, for example, starts to need to be factored in around housing and housing stock and location. Transportation corridors, all these things influence food access. Because if we're going to make differences on these complex issues like healthy food access, we need to see a complete picture. And in this particular picture of Cincinnati, you can start to see where their food access challenges are, where those orange spots are. Those are their food deserts. But overlaid with their assets, their grocery stores, their farmers markets, where their hospitals, their FQHCs, their churches. So we can start to see where our challenges and opportunities are. We're all starting to democratize data, which means we're democratizing meaning making, because only people in Cincinnati can actually tell us the real meaning behind these types of maps. They can tell us where the real opportunities and where the real challenges exist. It's very easy to get enamored of data and data visualization and all that eye candy, but the real power is when we start to kind of weave those into meaningful collective narratives around where we've been and where we need to go. That's really the battle for people's hearts and minds, and where we're able to kind of pivot from just data to start to move into places where we have collective solutions. Like here in Cincinnati, where they're starting to create more farmers markets or access to school gardens or community gardens, or change their food lunch program, or actually start to change their procurement policies in these areas. Data and tools like these are really a means to an end. They allow us to do a better job of learning collectively, acting collectively, to have different sectors sitting around the table, healthcare, YMCAs, governments, and others around common visions. This is what gives us our best chance. I was in Colorado the week before last with a bunch of community organizers, with climate change specialists, environmentalists, farmers, advocates for hunger, and they're starting to rally around what does an equitable food system look like in Colorado. And so we're going to be building a digital hub that's going to allow them to start to really visualize all of their food system in the state of Colorado, including distribution channels and how they can upload their agricultural data layers so they can start measuring economic, hunger, environmental goals in one place. And hopefully we'll be able to build that and evolve it with other states. Data will keep evolving, it'll keep changing, but what won't change is people working in groups give us our best chance of creating healthier communities, which is why we hope to keep building tools for these change makers, these coalitions. So I guess I'd say consider this an invitation to join the Commons, get in there, gain from it, contribute to that, and if you're interested in building something and sharing it with the rest of the country, we'd invite that as too. So thank you.